There is a private habit many men never discuss openly, yet it quietly occupies their thoughts as they grow older. Some wonder whether doing it too often could weaken their body. Others worry that doing it too little might lead to hidden health problems. And many simply live with uncertainty, relying on myths they heard decades ago. The subject is daily ejaculation. What really happens to the male body when ejaculation becomes a routine, almost automatic daily activity? Does it strengthen sexual health, or could it slowly create changes that men fail to notice until much later? Before we go deeper into this conversation, take a moment to hit the like button right now. Comment below where you are watching from. And subscribe so you never miss medically grounded strategies that could help you avoid unnecessary suffering as you age. Hello, gentlemen. I'm Dr. Hannah Cole. For more than 20 years, I have worked closely with men facing concerns related to erectile performance, prostate health, testosterone balance, and the gradual physiological transitions that occur throughout middle age and beyond. One of the most frequently whispered questions I hear in consultations is simple but loaded with anxiety. Doctor, is ejaculating every day bad for me? The answer is not as straightforward as many expect. The human body is complex, and sexual function reflects the interaction of hormones, nerves, blood vessels, emotions, lifestyle patterns, and even long-term habits formed over decades. To understand the real effects of daily ejaculation, we must begin by looking at how the penis actually functions. An erection is not just a moment of arousal. It is a coordinated vascular event. Blood vessels expand, smooth muscle tissue relaxes, and nerve signals transmit rapidly from the brain to the pelvic region. When ejaculation occurs, a sequence of muscular contractions releases seminal fluid, followed by a recovery phase during which the body returns to baseline. When this cycle happens occasionally, the body usually adapts easily. But when ejaculation becomes a daily routine, several subtle processes begin to unfold. One of the first areas affected is recovery capacity. In younger years, the refractory period, the time needed to regain full erectile readiness, is often short. As men age, hormonal shifts and circulation changes naturally extend this recovery phase. Daily ejaculation can sometimes lead to a pattern where the body does not fully reset before the next cycle begins. Over time, some men notice erections that feel less intense, less sustained, or slower to develop. This does not necessarily indicate permanent dysfunction, but it may signal that the body is operating under repeated stimulation without optimal restoration. Another aspect involves nerve sensitivity. The penile tissues contain a dense network of sensory receptors. Frequent stimulation can temporarily alter responsiveness, creating a phenomenon similar to sensory fatigue. Men may interpret this as reduced pleasure or diminished excitement, even when desire remains psychologically present. This shift can influence confidence. When a man begins to question his physical response, anxiety may develop. Anxiety itself interferes with erection signaling, creating a feedback loop that magnifies the original concern. Hormonal rhythm is also worth examining. Ejaculation influences short-term fluctuations in hormones such as prolactin and testosterone. While these changes are typically temporary, consistently repeating the cycle without sufficient rest, sleep, or nutritional support may contribute to overall fatigue patterns. It is important to emphasize that testosterone decline in aging men is influenced far more by body composition, sleep quality, stress exposure, and physical activity levels than by ejaculation frequency alone. However, when daily ejaculation occurs alongside poor lifestyle habits, the combined effect can be more noticeable. Circulation health represents another key dimension. Healthy erectile function depends on flexible arteries capable of delivering rapid blood flow. Men who maintain cardiovascular fitness often tolerate frequent sexual activity more comfortably. In contrast, those with sedentary lifestyles may experience subtle vascular strain when stimulation becomes habitual. Over months or years, reduced oxygenation of penile tissues can influence elasticity. This is one reason some men perceive changes in firmness or fullness as they age. There is also a psychological component tied to reward pathways in the brain. Sexual release activates neurotransmitters associated with pleasure and relaxation. When ejaculation becomes a daily coping mechanism for stress, loneliness, or boredom, the brain may begin associating relief primarily with this behavior. Gradually, motivation for other fulfilling activities may decline. This does not mean daily ejaculation is inherently harmful. Rather, it highlights the importance of balance and self-awareness. Another frequently overlooked issue involves pelvic floor fatigue. The muscles involved in ejaculation play a role in erection stability and urinary control. Repeated contraction without adequate recovery may contribute to subtle muscular tension patterns. Some men later experience discomfort or decreased control, which they mistakenly attribute solely to prostate issues. Speaking of the prostate, daily ejaculation has been widely discussed in relation to prostate health. Some observational research suggests that regular ejaculation may help clear prostatic secretions, potentially reducing congestion. However, this benefit appears to plateau. Beyond moderate frequency, additional ejaculation does not necessarily provide extra protection. In fact, men who combine excessive sexual activity with dehydration, poor sleep, and chronic stress may experience inflammatory symptoms that counteract potential advantages. Energy perception is another area men often report. After ejaculation, the body enters a relaxation phase mediated by neurochemical shifts. When this happens occasionally, it can support better sleep and stress reduction. When it happens daily, particularly at night, some men describe persistent low-grade fatigue or reduced morning drive. This sensation is highly individual and influenced by diet, fitness level, and mental health. Still, it reinforces the idea that the body functions best when stimulation cycles are aligned with overall wellness routines. Emotional well-being cannot be separated from physical outcomes. Men who feel pressured to maintain constant sexual output, whether due to personal expectations, media messaging, or relationship dynamics, may ignore internal signals of exhaustion. Over time, the pursuit of performance can overshadow genuine intimacy. Healthy sexuality evolves with age. It becomes less about frequency and more about quality, connection, and sustainability. One particularly important insight concerns perception of penile size. Frequent ejaculation does not anatomically shrink the penis. However, if erections become less engorged due to vascular fatigue or hormonal fluctuations, the visible appearance may seem reduced. This perception can trigger insecurity, even when structural changes are minimal. Restoring circulation through exercise, improving sleep hygiene, and managing stress often reverses these visual concerns more effectively than altering sexual frequency alone. Let us also consider metabolic health. Conditions such as insulin resistance, high cholesterol, and hypertension gradually influence vascular integrity. When these factors coexist with daily ejaculation habits, men may misinterpret declining performance as purely sexual rather than systemic. Addressing root causes leads to better long-term outcomes than focusing on one behavior in isolation. Another subtle factor involves hydration and nutrient depletion. Seminal fluid contains trace minerals and proteins. While the body replenishes these efficiently under normal circumstances, men with poor dietary intake or high stress loads may benefit from allowing recovery intervals that support full physiological restoration. Ultimately, the question is not whether daily ejaculation is good or bad. The real question is whether the behavior fits within a broader framework of balanced health. Men who exercise regularly, sleep deeply, eat nutrient-dense foods, manage stress constructively, and maintain emotional connection often tolerate higher sexual frequency without negative effects. Men who neglect these foundations may experience cumulative strain. Listening to the body is essential. Warning signs such as persistent fatigue, declining erection quality, pelvic discomfort, or reduced libido should prompt reflection and, if needed, professional consultation. Early awareness allows adjustments before patterns become entrenched. The goal of discussing this topic is not to impose rigid rules. It is to encourage informed autonomy. Sexual vitality is part of overall vitality. Protecting one requires protecting the other. As you move forward, consider viewing ejaculation not as a daily obligation or a forbidden act, but as one element of a larger rhythm involving rest, activity, emotional well-being, and long-term health vision. When these elements are aligned, men often discover that performance anxiety fades, confidence returns, and intimacy becomes more satisfying without constant effort. Your body is remarkably adaptive. Given the right conditions, it responds with resilience. If this deeper exploration has helped you understand your physiology more clearly, make sure you subscribe for more evidence-based discussions on erectile strength, prostate protection, testosterone stability, and confident aging. And if you want to learn about the silent early circulation signs that can predict future performance changes, watch the next video on your screen now. Acting early could make a meaningful difference in how you feel years from today.